Have you ever wondered if all the medical tests your doctor suggests are truly necessary, especially after turning 70? Sometimes, more tests don't always mean better care. In fact, for many seniors, some tests can bring more stress than solutions. As we grow older, our health becomes more precious than ever. Doctors may recommend several tests, blood work, scans, screenings, all in the name of prevention. But here's something important to remember: not every test adds value after a certain age. Some may lead to unnecessary treatments, anxiety, or discomfort, especially when results show minor issues that don't really affect your quality of life. This video isn't about ignoring medical advice, it's about asking the right questions and making informed choices that fit your personal health, age, and comfort. So today, let's talk calmly and clearly about 5 medical tests that seniors should discuss carefully with their doctor after age 70, and what you can do instead to stay healthy, peaceful, and confident in your care. 1. Routine cancer screenings, especially colon, prostate, and breast cancer tests. In your younger years, cancer screenings are incredibly important. They can detect problems early when treatment is most effective. But after age 70, especially if you've had normal results for years and have no symptoms, continuing every test might not always be necessary. For example, colonoscopies can become risky with age. The procedure can cause dehydration or even complications like bleeding. Similarly, prostate exams, PSA tests, and mammograms may sometimes pick up very slow-growing cancers that would never cause harm, but the treatments that follow could lead to stress, side effects, and unnecessary pain. The key is personalized care. If you're generally healthy and active, your doctor may still recommend certain screenings. But if your health is fragile or your past tests were always clear, it's okay to ask. Do I still need this test, or would observation be better for me now? Have you ever felt unsure about whether to continue a certain medical test or screening? How did you decide? 2. Routine heart stress tests or ECGs without symptoms. Many seniors are sent for heart tests just to be safe. But if you don't have symptoms like chest pain, shortness of breath, or dizziness, these tests may not be necessary. A stress test, where you walk on a treadmill while hooked to heart monitors, can sometimes show mild abnormalities that don't actually require treatment. This can lead to further tests, procedures, or medications that may not improve your quality of life. Instead, focusing on simple lifestyle habits like daily walking, balanced meals, and regular checkups often tells your doctor more about your real heart health than a test alone. Remember, tests should guide care, not create fear. Before we continue, I'd love to pause for a moment and hear from you. Have you ever been asked to take a medical test that later felt unnecessary, or perhaps caused you more worry than help? Please share your thoughts in the comments. Your experience might gently guide someone else watching today. And if you're finding comfort or value in this video, do take a second to like, share, and subscribe. It helps our little community grow, and it means so much to us. 3. Memory or dementia screening without noticeable symptoms. As we age, forgetfulness happens. Misplacing glasses or forgetting names now and then is part of normal aging. But some clinics offer quick dementia or memory tests to everyone over 65, even without real symptoms. These screenings can sometimes cause unnecessary fear or labeling, especially when mild forgetfulness is mistaken for something serious. If you're functioning well in daily life, managing your tasks, and staying socially active, you may not need routine memory testing. Instead, focus on mental fitness, puzzles, conversations, reading, or learning new hobbies, all of which protect your brain naturally. 4. Frequent blood tests or full panels without a specific reason. Blood tests can reveal a lot, but taking them too often can also cause confusion. Some doctors order full blood panels every few months, even when there are no new symptoms. This may lead to chasing tiny, meaningless changes in numbers, which can cause anxiety or extra medication that's not needed. If you feel fine, eat well, and take your medicines regularly, simple yearly tests may be enough. Always ask, is this test necessary right now, or can we monitor my health in another way? Remember, your health is not just numbers, it's how you feel each day. 5. Full body scans or imaging, just to be sure. This is becoming more common. Many seniors are offered full-body CT or MRI scans for peace of mind. But these scans often find harmless things, tiny spots or shadows that lead to more tests and unnecessary fear. Imaging also exposes you to radiation in CT scans, which can add risk over time. If you have no symptoms, it's often better to focus on regular checkups and report new changes early instead of scanning your whole body. Talk with your doctor openly. A trusted doctor will explain whether a scan truly adds value or just adds worry. So, let's gently recap the 5 medical tests seniors should question after age 70. 1. Routine cancer screenings, discuss whether they're still necessary. 2. Heart stress tests, only if you have symptoms. 3. Memory tests, when there's genuine concern, not just forgetfulness. 4. Frequent blood tests, when there's a medical reason, not habit. 5. Full body scans, avoid, just to be sure, tests that cause anxiety. Remember, dear friends, aging is not an illness. It's a stage of wisdom, experience, and calm understanding. Tests are helpful when they improve your quality of life, but they shouldn't take away your peace. Always ask your doctor with confidence. Will this test help me feel better, live better, or understand my condition better? If the answer is no, it's okay to take a step back and choose peace over panic. Before we end today's video, I'd love to know your thoughts. Which of these medical tests do you think seniors should discuss more carefully with their doctor? Your insight might truly help another viewer who's unsure about their own health decisions. And if this video brought you a bit of peace or understanding, please like it, share it with a friend, and subscribe to our channel for more calm, caring talks, made especially for you.